Today we are going to discuss about classification of malocclusion. What is a classification system? It's nothing but grouping of clinical cases of similar appearance for ease in handling and discussion. It is not a system of diagnosis, nor it is a system of determining the prognosis or a way of defining the treatment. It's just grouping all the clinical cases of particular characteristics into one specific group. That means assigning the clinical cases of similar characteristics into one group is called as is the main purpose of classification system. Now, before entering into classification of malocclusion, let us know what is the actual meaning of occlusion. Occlusion, the literal meaning of occlusion is closing up. When we see the definition of a occlusion, it's nothing but a relationship of maxillary dentition to the mandibular dentition when the jaws are closed with the muscles in a relaxed position, that means without any strain on the muscle, and when the condyle is not displaced from the fossa. That means occlusion is nothing but the relationship of maxillary and mandibular teeth with respect to each other when the jaws are closed with the condyles in a relaxed position in centric relation with the muscles unstrained. This is the definition of occlusion. Now, what is a normal occlusion and what is ideal occlusion? We have a lot of confusion between these two, but the ideal occlusion is a hypothetical concept, whereas normal occlusion is the occlusion with all its features closer to the ideal occlusion. That means ideal is a center and the normal occlusion includes all the occlusal features which are running in close relationship with this ideal hypothetical concept. So now what is a normal occlusion? It's nothing but the occlusion which satisfies all the Andrews 6 keys like class 1 molar relationship, mesodistal crown angulation, buccolingual crown inclination, absence of rotations, no spacings, and relatively flat curve of P. So these are called as Andrews 6 keys of optimum occlusion. So any occlusion that satisfies these 6 keys is supposed to be a optimum or normal occlusion. Deviation from any of these keys will be considered as a malocclusion. Apart from satisfying the Andrews 6 keys, or we can put it in another way, if an occlusion satisfies Andrews 6 keys, then we can also have something called as Engel's line of occlusion with respect to that dentition. Now what is Engel's line of occlusion? It is nothing but it's a line that passes through the central fossae of all the maxillary posterior teeth and incisor edges of the the cingulae of the incisors. That means a line passing along the central fossae of maxillary posteriors and along the cingulum of the maxillary incisors, and the same line passes along the buccal cusp tips of posterior teeth and incisor edges of anteriors in the lower arch. This is called as Engel's line of occlusion. An optimum or a normal occlusion has all the Andrews 6 keys satisfied along with the Engel's line of occlusion. Any deviation from these characteristics is considered to be a malocclusion. Now, what is a malocclusion? Any deviation from a normal or optimum occlusion is called as a malocclusion. Now, a malocclusion may differ from person to person. So, when I say that a person has particular characteristics, the clinician should understand all the characteristic features of that particular dentition. For example, if a patient has a crowding, spacing, molar relation that is not a class 1 relation, deep bite, open bite, I can't specify all these things, right? A particular patient is having a cross bite, deep bite, open bite. So rather than specifying each and every feature of the dentition, we can broadly classify a malocclusion so that a particular terminology will give you a clear-cut picture of the entire characteristic features of a particular malocclusion occurring in an individual. So, what is the necessity to classify a malocclusion? It's nothing but to group certain malocclusions together which may not have a similar etiology. That means the characteristic features of the malocclusions coming under one group might be similar, will be similar, but the etiology behind these malocclusion might be different. So, main reason of classifying a malocclusion is to assign the occlusion with particular characteristics into one group. And also, one more important advantage of classifying a malocclusion is, ease of communication, ease of understanding. Okay, once we say that a person is having this kind of malocclusion, then we can assume in your mind that, oh, this person is having this kind of molar relationship, this is the relationship between the incisors, and this is how the teeth are aligned. So the entire picture of the dentition will come into mind when we put all the characteristic features into single terminology. That means the reference will be easy, comparison will be easy, and the communication between the patient and the patient and the dentist, and between two dental surgeons will be easy by classifying a malocclusion. Now, we can think a possible modality of the treatment when we have a clear-cut picture of a malocclusion. Coming to the systems of classification, various systems of the classification of malocclusion are available, but most important among them are Angles classification system, Simmons system of classification, Ballard's classification system. This is also called as British Standards Institute classification, Ackerman and Profit classification, and WHO classification. Of these classification systems, the most important ones are the Angles system of classification and Ackerman and Profit system of classification. Let us discuss about these classification systems one by one in a detailed manner. Let us now discuss about Angles classification system. This is the major system that is being followed clinically, and it has much importance in clinical orthodontics. This classification system was proposed by Edward Hartley Angle, who is supposed to be father of modern orthodontics. The classification system is based mainly upon maxillary permanent first molar relationship. According to Edward Angle, maxillary permanent first molar is considered to be the major key for occlusion. According to this classification, we have three types of malocclusions. Leaving the normal occlusion aside, we have three types of malocclusion. Actually, Edward Hartley Angle classified occlusion into normal occlusion, class 1 malocclusion, class 2 malocclusion, and class 3 malocclusion. I have already told you about Angle's line of occlusion, which comes under normal occlusion. Now we will be discussing about what is class 1 malocclusion, class 2 malocclusion, and class 3 malocclusion. A class 1 malocclusion is a malocclusion where the mesiobuccal cusp of maxillary first permanent molar occludes with the mesiobuccal groove of mandibular first permanent molar with presence of either rotations, crowdings, or any kind of tooth malpositioning in the rest of the dental arches. This is Angle's class 1 malocclusion. Now, what is Angle's class 2 malocclusion? Angle's class 2 malocclusion is nothing but a malocclusion where the mesiobuccal cusp of maxillary first permanent molar is occluding mesial to the buccal groove on the mandibular first permanent molar. That means the maxillary first permanent molar lying more mesial to the mandibular first permanent molar. Again, we have two types of class 2 malocclusions. In a class 2 division 1 malocclusion, we have a class 2 molar relationship with proclined upper anteriors with increased overjet. And the other type of class 2 malocclusion is class 2 division 2 malocclusion. Here we have class 2 molar relationship and retroclined upper anteriors. You can note it down in the image. Either the two central incisors might be retroclined with the laterals overlapping with the centrals, or four maxillary incisors might be retroclined with the canines overlapping these retroclined incisors. So this is class 2 malocclusion. Now what is class 3 malocclusion? Class 3 malocclusion is nothing but a malocclusion where the mesiobuccal cusp of maxillary first permanent molar occludes distal to the buccal groove on the mandibular first permanent molar, with either the presence of reverse overjet or end-on-end relationship, whatever it is. So these are the three types of malocclusions according to Edward Hartley angle. Apart from these, if a patient has class 1 molar relationship on another side, class 2 on the other side, then we call it as a subdivision. Okay, so we have class 1 malocclusion, class 2 malocclusion, class 3 malocclusion. In the class 2 malocclusion, again we have division 1, division 2, and overall we have subdivision also, wherein the molar relationship is one on one side and another on another side. Again, a class 3 malocclusion might be a true or a pseudo. What is a true class 3 and what is pseudo class 3? True class 3 is nothing but a true class 3 molar relationship, whereas a pseudo class 3 is a class 3 molar relationship that occurs due to the functional shift of the mandible. For example, if a patient has any single tooth or multiple teeth cross bites or occlusal prematurities due to high points in the restorations, whenever the patient closes from the postural rest position to habitual occlusion, there will be shift of the mandible in a forward direction, which will lead to a molar relation which will be class 3, which is not actually class 3. Due to the functional shift of the mandible, it looks like a class 3. So you should be able to differentiate a class 3 malocclusion from a pseudo class 3 from a true class 3. Now what is the feature, how we can differentiate between a true class 3 and a pseudo class 3? The main feature is, if you manipulate the mandible of the patient with muscles in a relaxed position, if you are able to take the mandible of the patient backwardly to an edge-to-edge relationship without any subjective pain in the temporomandibular joint region, then it is supposed to be a pseudo class 3. If you are unable to take the mandible of the patient back into edge-to-edge relationship without strain on the TMJ and the muscle, then it is taken as a true class 3. That means when a class 3 malocclusion is a pseudo type, the patient's mandible can be taken back into edge-to-edge relationship of the incisors without any strain in the temporomandibular joint region, whereas in a true class 3, it is not possible to take the mandible of the patient into a edge-to-edge relationship without strain in the TMJ and muscles of the the muscles that are attached to the mandible. Now, how can you differentiate between a true class 3 and a pseudo class 3? It can be done clinically. If you can manipulate the mandible of the patient such that you can take the mandible backward such that the maxillary and mandibular incisors can be brought into an edge-to-edge kind of relationship without pain in the temporomandibular joint region, then it is considered to be a pseudo class 3. Whereas if you are unable to take the mandible into a relationship such that the maxillary and mandibular incisors will lie in edge-to-edge relationship without strain in the TMJ, then it is supposed to be a true class 3. So whenever you are planning a treatment, you have to first finalize the diagnosis whether it's the class 3 is a true kind of class 3 relationship or is merely a result of occlusal prematurities or functional shift. Now, what are the shortcomings of the angle system of classification? It does not consider malocclusion in a vertical or transverse planes. If the permanent first molar is missing, there is no provision for classification of malocclusion, and this angle system cannot classify a deciduous occlusion or deciduous dentition. And even the malocclusion does not indicate any, the classification system does not indicate any etiology behind the malocclusion that is defined, and the skeletal relationship is not considered here, and even the malocclusions due to malfunctions of the muscles and bones are not considered over here, and even it does not indicate the complexity of the problem. It just says angles class 1, class 2, class 3. For example, if I say angles class 1, the patient might have a skeletal deep bite or a dental deep bite or severe crowding. That means it just lays emphasis only on molar relationship, and it does not specify where the crowding is present and whether it is where the malocclusion in transverse plane or vertical plane is present, whether there is a skeletal component, whether there is altered muscle balance. Nothing is indicated by angle system of classification. It just notifies the molar relationship. So it takes only the maxillary permanent first molar as a key tooth in determining the malocclusion. So some authors modified the angle system of classification by adding some more features. Here the main modifications are by Lisch's modifications and Dewey's modification. Coming to Lisch's modification, he has given few terminologies like neutro-occlusion, where angles class 1 malocclusion or angles class 1 molar relationship; disto-occlusion, that means the lower molar is occluding distal to the upper molar, it notifies angles class 2 molar relationship; mesio-occlusion means lower molar occluding mesial to the upper molar, which indicates angles class 3 molar relationship; bucco-occlusion, that means crossbite; lingo-occlusion means lingually placed tooth, this also leads to crossbite. It depends whether the maxillary upper molar, the maxillary permanent molar or premolar are more buccally placed or mandibular, or whether the mandibular are more buccally placed with respect to the maxillary. It depends upon the clinical situation. Now, supra-occlusion, that means supra-erupted teeth; infra-occlusion, infra-erupted teeth, that means the teeth which are not yet erupted into the occlusion; mesioversion, that means the teeth is drifted mesially; distoversion, the teeth is drifted distally; transversion means transposition, interchange of the position between two teeth; axiversion, that means abnormal axial inclination of the teeth; and torsiversion, that means rotated teeth on its axis. So these are different terminologies that have been given by Lischer. Now coming to Dewey's modification, Dewey has given 5 modifications to angles class 1, no modifications to class 2, and around 3 modifications to angles class 3. Now coming to the angles class 1 Dewey's modifications, we have type 1 where the anteriors are crowded, type 2 where the maxillary incisors are proclined and spaced, type 3 where there is an anterior crossbite, type 4 where there is a posterior crossbite, and type 5 where it's similar to type 1 but it is not due to rotations, rather it is due to drifting of the teeth. Okay, so angles class 1 type 1 indicates angles class 1 molar relationship with Dewey's modification type 1. Angles class 1 type 3 indicates Dewey's modification type 3 and angles class 1 molar relationship. This is how the Dewey's modification will give you an idea of even about in which area the specific deviations of the normal tooth positioning is present, and what type of deviation, whether it's a crowding, spacing, whatever it is, will be given by Dewey's modification. Angles class 2 has no modifications given by Dewey's, whereas there are 3 modifications for angles class 3 malocclusion. Type 1 is mandibular incisors are overlapped with maxillary incisors, but mandibular incisors are crowded. That means there is no reverse overjet. Whereas type 2 means upper and lower anteriors are in an edge-to-edge relationship, and type 3 means there is an anterior crossbite. That means angles class 3 malocclusion, Dewey's modification type 1 indicate the characteristic feature of overlapping of lower anteriors by upper anteriors with crowded lower anteriors. Type 2 device modification of angles class 3 malocclusion indicates that the molar relationship is class 3 and there is an edge-to-edge relationship between maxillary and mandibular incisors, whereas angles class 3 device modification type 3 indicates that the molar relationship is in a class 3 but there is a reverse overjet. Okay. The next system of classification is Simon's system of classification. This system of classification takes 3 reference planes to notify a malocclusion. When we take a Frankfurt horizontal plane as a reference, we have 2 types of malocclusions. One is attraction, another one is abtraction. That means when the dentition is closer to the FH plane, then it is called as attraction. When the dentition is away from the FH plane, then it is called as abtraction. Similarly, we can even specify the malocclusion with respect to the orbital plane. Okay, orbital plane. When the dentition is closer to the orbital plane, which is called as retraction. When the dentition is away from the orbital plane, then we can call it as protraction. Yet we have another plane to classify a malocclusion, that is mid-sagittal plane. When the dentition is closer to the mid-sagittal plane, it is called as contraction, whereas the dentition which is away from the mid-sagittal plane is called as distraction. So either attraction or abtraction, protraction or retraction, contraction or distraction. This is the Simon's system of classification. Actually, this system of classification gives you a 3-dimensional image of a malocclusion, and it lays emphasis on the orientation of the dental arches with respect to the facial skeleton. But the disadvantage is it's a bit time-consuming procedure and it's cumbersome procedure. So it's a time-consuming classification. We have another system of classification by Moyers called as etiological classification system. That means this system of classification will classify a malocclusion with reference to its etiology. A malocclusion due to the involvement of skeletal structures is called as osseous. A malocclusion which has involvement of aberrant muscle activity, we call it as a muscular. And a classification where the mal relationship is purely due to dental malpositions, then it is called as a dental. So we have osseous, muscular and dental kind of malocclusion according to Moyers. One more system of classification is Ballard's classification. This is also called as classification by British Standards Institute. This system of malocclusion classification is based upon the relationship of cingulum of maxillary central incisor and incisal edge of mandibular incisor. If the incisal edge of mandibular incisor lies just beneath the cingulum of maxillary incisor, it is called as class 1. If the incisal edge of mandibular anterior lies more distal or more behind the cingulum of maxillary anterior, then it is called as class 2. If the incisal edge of mandibular anterior or mandibular incisor lies more anterior to the maxillary incisal edge, then it is called as a class 3. One more important classification system is given by Ackerman and Profit. This classification system gives you a comprehensive idea about the characteristics features of a particular malocclusion. The Ackerman and Profit system of classification is a 5-step classification and it's a diagrammatic classification. Here we look the malocclusion in 5 steps or 5 stages. Step 1, we look for alignment and symmetry, and we define a malocclusion whether there is whether the alignment and symmetry is ideal, whether there are any spacings or crowdings in the dental arches. Step 2, we look at profile and divergence of the face, whether the patient is having a convex profile, straight profile or concave profile, whether the face is anteriorly divergent, straight divergent or posteriorly divergent. In the step 3, we look for the relationship of the teeth in transverse plane, whether there is any crossbite whether the the maxillary buccal cusp, the maxillary molar is completely overlapping the mandibular molar, or mandibular molars are completely buccally related to the maxillary molar. So the transverse relationships of the teeth are looked in step 3. Step 4, we look for sagittal relationship, or relationship of teeth in sagittal plane, whether it is an angles class 1, class 2 or class 3. The 5th step is relationship of teeth and skeletal structures in vertical plane, whether there is a open bite or deep bite. Again, if there is a open bite, whether it is a skeletal or dental. If it's a deep bite, whether it's a skeletal or dental. This is how the Ackermann and Profit system of classification gives a comprehensive it's a comprehensive classification which points out each and every characteristics of dentition in all the planes of space, which can be carried out in 5 steps. Actually, we can represent the Ackermann Profit system of classification by means of a Venn diagram. The larger square box indicates arch alignment, whether the arch are optimally aligned or whether there are any crowdings and spacings. A big circle within the box indicates profile, whether the face is convex, concave or straight, and divergence, whether it's a straight, anteriorly divergent or posteriorly divergent. Whereas each of these 3 small circles indicates the relationship in transverse plane, sagittal plane and vertical plane. So the point of intersection of all these 5 steps is a more complicated malocclusion. Okay, this is how the Ackermann and Profit system of classification gives a comprehensive idea about the characteristics features of a particular malocclusion. So these are the different systems of malocclusion which have been proposed by different authors. Of these, angles classification system is most commonly used, but all the characteristics features of a particular malocclusion can be given by a Ackermann and Profit system of classification. Hope you understood. Thank you.